we are live right now. So thank you everyone for coming on time. So I'm gonna start to share my screen, and today we're gonna give you guys updates on what is going on, and you'll be able to ask your question at the end of the day. My name is Sherry Adeoshun, President of the Loan Foundation. Thank you for joining us. We had a meeting as we normally do with the Department of Health today. And then this is just summary of the feedback that we had today. Okay, so let's go. Let's take this. Where's the play button? Give me a minute. Let me move stuff around. Okay, I'm trying to find the play thing and I don't see. Okay, so I'm just gonna slide. Okay, anyway, I'm just gonna show you this way. It's not the best option, but I'm gonna show you this way anyway. So you can see the first thing you see on the screen is a transmission update citywide. So let's go to the next slide, which gives a summary of what is going on in the city. You guys can see that this talk about the measure, the last 7 days average. And this next column, the third column, talks on the last average in the last 28 days. And the last column talks about the explanation. So we can see the percentage positivity in the last 7 days is 6.9. And previous 28 days, it was 6.02. So we can see that it's increasing. It's not increasing by a lot. You know, when you actually look at the number, it was 2,281 and it used to be 217. It's now 2,281, just about a little over, close to 200 and something, 200 increase. So hospitalization actually was 43. It decreased back to 40, and confirmed death was 4 in the last 28 days. In the last 7 days, it's 3. So that is decreasing. The confirmed death is decreasing, as you can see. So this is the trend that we have right now in New York City. And I'm going to go to the next slide. We sort of explain like a positive change, a policy change. I know last week we discussed that how do they determine the rate of the positivity? They use the test, the number of the people that actually comes into the clinic to test. The number of the positivity rate compared with those that were negative. That's how they used to determine, and also the hospitalization. But there's an important thing that happened from April 4th. The Federal Department of Health and Human Services no longer requires a report of negative results for COVID-19 antigen tests. Those are the tests that happen in the clinic and urgent center and the hospital. So since they're not requiring the negativity result, that means you can compare it with the positivity result to get the positivity test. So as a result, the percentage positive metric will be computed using only the lab reported CPR result, which should be just the positive test. So reporting of the new daily cases and cases per 100K will continue to include both the PCR and the antigen test. So due to this change and other factors, including the changes in the testing practices, the most reliable metric is the measure of the impact on the communities, the cases per 1,000 data, not the percentage positivity that was being used before. So just wanted to point that out. It doesn't really change anything from our hand, but it's just good information to know how these decisions are being made. Okay, okay, great. Thank you for bringing that person in. I know you guys are familiar with this chart that's red, orange, and green. And then it's talking about very high, medium, and low. So everyone is familiar with this. Right now in New York City, we can actually see where our level is right now. New York City is low. The alert level is low. The cases in the last 7 days, I showed that earlier, is 191.56. It's stable. It is increasing, but it's sort of stable. It was 6.1, now it's like 6.7. You know, so the hospital occupancy, it's increasing a little bit. So we're just gonna keep an eye on that. So the other area that I want to mention today is the hospitalization pattern. What is it affected by the vaccination status of the people in the community? You can see this very dark blue, this line at the bottom. You can see that line, and you can see the one in the middle, the dark blue one. So the people that are vaccinated and been boosted, you can see how the level of hospitalization per 1,000. This is the number of hospitalization per 1,000 people. So those that are boosted, they are way less than 50, which is, I think, even lower than 25 or 20. And you can see the rate of the unvaccinated. So the people that are like hospitalized mainly with a higher level in the 100,000 per capita of people is actually those that are unvaccinated. So we can see that the data leads to the fact that even though when you're vaccinated, it doesn't preclude you from getting infected, but it prevents the severity. And that's the message we've been pushing since the beginning. So let's take a look at who are the people that are most likely to get sick with COVID-19. Whether especially whether they're vaccinated or not vaccinated, the people that are mostly are at risk to get really sick are people that have other pre-existing condition. People that are older than 65. That's why we push that are elderly get vaccinated, get boosted. The second booster shot is going on for the elderly. People that are not physically active, people who have received organ transplant, people with weakened immune system, pregnant or recently pregnant people who smoke or formerly smoked, people who have underlying medical conditions such as cancer, cerebrovascular disease, chronic kidney disease, chronic lung disease like moderate to severe asthma, chronic liver disease like cirrhosis of the liver, dementia, people with diabetes, heart condition, HIV, mental health condition, obesity, some disabilities like Down syndrome and tuberculosis. So those are the people that are most likely to get sick when they contact the virus. So one of the other things I think is going to come on later on in the slide is I want to mention the availability of medication, especially to those people that may fall in this category. So there's the Paxlovid, the antiviral medication that is available, that you can call that number, the 212 COVID-19 number. If you fall into this category and you test positive, even if you test positive at home, you can call that number, and so they'll be able to make arrangement. Can you mute yourself, please? They'll be able to make arrangement to make sure you get the medication delivered to you. Even if you don't fall under this category, you still want to call for counseling, or you can also go to audience center or go to your medical care, your healthcare provider. So this chart shows the percentage numbers of tested cases each week over the past 3 months that have the most common variant in New York City, including Delta and Omicron. So you can see the one that has the most common cases based on the testing that we really researched in New York City. We can see Omicron BA2 has been the most that have been seen, but because a lot of people has been vaccinated, it really reduced the spread in the community. But remember, we had said the Omicron BA2 is like really very virulent compared to the previous one. So, but the vaccination and the boosted vaccine that took place really helped to really retard its effectiveness, its virulency, or its effects in our community, so we can still stay reopened and not shut down. So this table shows how many New York City residents have been vaccinated, to prove how vaccine has really been increasing, to all the great work you guys are doing out there, the Reloom team, and those of you even spreading it in your community by the word of mouth. So we have this put together by borough. We have Bronx, Brooklyn, Manhattan, Queens, and Staten Island. You can see over 7 million people have gotten at least one dose of the vaccine. So that's 87%. 87% of New Yorkers have been vaccinated. I think that's a good thing. New York City, that is good. And over 6 million have been fully vaccinated. That's 78%. And over 3 million received the additional dose. So, the numbers are like really good citywide, but then when you bring it down to different community and different ethnic group, you might paint a different picture, but this is good. A lot of the goals that was set at the beginning has been accomplished. So kudos to all the great work all the partners are doing in the community. So this next slide just breaks it down further to see what age group has been vaccinated, the percentage of vaccination based on age group. You can see the first set of row is just talking about the ages. Are they fully vaccinated? How many percent in that age group is fully vaccinated? And then as we go down, you can see, and this breaks it down by ethnic group, and the bottom here breaks it down by male or female. So you can see about the same average, like 86% male and female received the first dose, and fully vaccinated 78% male or female. So it's like neck to neck. And the booster, there's a little bit more female got the additional dose for booster. So that is looking good. Okay, just let's look at a little bit of important updates. Moderna, this is good news for those that have babies, and we have several questions on this platform regarding when are they gonna get the vaccination out to the babies, all right? Okay, Moderna submitted a request with the FDA for emergency use of authorization for its SARS COVID-19 2 vaccine for children ages 6 months to 6 years to 5 years. So they have one up to 5 years already. So this is really great. So the request that has been supported by 2 phases of the clinical trial. The first phase being like first phase in the lab, then another phase required about 100 people. So this last phase that they did, clinical trial, involved 6,700 children. So the result included that 2 25 microgram doses of Moderna vaccine can evoke a similar response in young children like the one that adults got. For adults 18 to 25, we got 100 microgram, 2 doses of it. So with the children 6 months to less than 6 years old, they can get this vaccine at 25 microgram. It has not been approved yet, but it's already been submitted with proof of clinical trial documentation. So that is really, really, really amazing. I know I spoke earlier when I referred you to people that are at high risk of getting really sick with if they get infected. So it's really important for those people to call to get the antiviral medication or the monoclonal infusion if they qualify for it. So a new study by Medrick's usage and awareness of antiviral medication for COVID-19 showed that a lot of people are not really accessing this particular medication, and those that even qualify are not even aware of it. So one of the message we want you guys to push out there is they can get the medication, especially if they fall under that category. But either way, if you test positive, whether it's at the clinic or at home with the rapid test, you want to call the 212 COVID-19 hotline and start the process, and they will ask you the needed question to determine if you qualify for those medications. So we have passed the stage where we want to suffer in silence and use all kind of home remedies. The home remedies are good, but we have extra cushion, extra support that will really help to cut short the length of the infection and make you feel better sooner. So that's one of the message we're going to be pushing this upcoming week. I'm going to actually have the team, the creative team, to create a flyer or messaging with that particular aim in mind. Okay, some good news by vaccine, by equity, by race. You can see that the vaccination moved from 54 to it's approaching like 65% in the tri-neighborhood, 57 to 65% in the tri-neighborhood. It's been moving really slowly, because we do know that when you look at it at the broadly in New York City, we're way over 70 in the 80% vaccination. But when we go to the area, the tri-neighborhood, the neighborhood that are disadvantaged and Black and brown community, the percentage is still way below 70%. So, and that's one of the objectives. So it moved to 65%, and the goal is to hope that it will move, we'll get to that 70 by June. We hope we can accomplish that. So keep up the good work. So this is just showing you the vaccination status by age group, and it increased from 74 to, is above actually 80%, but I don't know why it's showing in the number is 82% from 78 to 82%. So we're doing good in that age category in the try and the not try neighborhood. Okay, so those are some of the highlights I want to share with you guys today. And I think one of the take home should be, if you feel sick, call that 212 number or go to your primary care physician so you can get medication. You don't have to suffer in silence. So that is all I have to share with you today. I don't know if you have any questions, any concern. The medication is Paxlovid. I will put the spelling in the chat in a minute. Okay, any other question, concern, comment, or anything you saw on the news? Actually, I saw a few things on the news that I wanted to share with you guys. I was seeing the mass, what do you call it? The mass testing going on in China. Did anybody see that on the news about a day or two ago? That they're trying to make China like a no COVID. They want to check everyone, to test them if they have COVID-19. I thought that was interesting. Huh?
I saw it on the news.
You saw it on the news, right? I thought that was interesting, but leave it to China because they're like brutal. They will make sure it happens. I don't know if it's going to produce any favorable result, but that's the technique. Yeah, just was thinking of that. Okay, so let me give you the spelling of the Paxlovid. Any other question, comments, or anything going on that you want to bring to our attention?
Sherry?
Paxlovid. I'll put it in the chat. Yes, go ahead.
Yeah, I just, my husband was asking me to ask, we're due for the booster, for the booster. And he said that he heard someplace that it's better to wait for the fall, like September, something like that, because that's when there's more chances of you getting it instead of taking it right now. So what is your
I don't think it's better to wait, because once you qualify, you should get it, because it takes about a few weeks to get into your system before it can actually be effective and you can build that immunity. So it doesn't happen, the immunity doesn't get built like on the spot. So I think it's about 2 to 3 weeks after you take it, because before that immunity is built. So you can get it now, and then if there's need for another one, then they will approve that. So don't worry about waiting for the fall.
I just wanted to add something else. Talking about China, I go to a doctor that's in an area in Brooklyn where it's all Chinese, that she's a Chinese doctor. And when we went there during the pandemic, with our mask, every single person had a mask on, and all the businesses were thriving. And the only one I saw without a mask were two American, what you call non-Asian people that didn't have a mask. But I'm just saying, it's amazing that they all, I guess it's because it's one whole community, they're all the same nationality, but their business was thriving. The stores were all open. I wish they had taken that picture of that on television.
Wow. Yeah,
and then wait a minute, and then I keep walking, and there was another neighborhood, and they were Hasidim. They're they call it anyhow Hasidim. They were there without masks, walking around, whole families. It was like unbelievable, like a curtain, just came down, and the whole neighborhood, nobody had masks. I just thought that was so incredibly interesting.
Yes, it is. It is. I think that's one of the things that the people in the Asian community, they caught on to that really fast, but they've experienced the bird flu and all kind of other endemic situation in their community, that they were prepared for that. And they knew the effectiveness of the mask in really preventing the spread of the virus. So yeah, so all well and good. So any question, comments, concerns, anything you want to talk about tonight? Okay, it seems like all hearts and minds are clear tonight. Okay, I see a hand up. Okay, go ahead, Sabrina.
Oh, yeah, good evening, everyone. Today, while we was at the train station, they're really asking about where to get the second booster, third booster. Some said first time. So most of I told them was St. John's, but is there any updates that you know of, or anyone that's on the line that we can relate to them better for
I
Far
think
Rockaway?
I think it's only the main one is only St. John, because even some of the testing center, you see that testing center that's across the street from McDonald's, I heard it might be closing down or is already closed down. So you can highball that for me tomorrow. Whoever is in the office to let me know if that is still open.
Okay, I
And
will.
yeah, so that's the only one, and the other thing will be like the vans, and the vans are not stationary in one place, they're constantly moving. But we know the St. John is a reliable place in the community that they can get in, and also the CVS. They can call into CVS and get vaccinated from there. So I think at this point, because people have been like babied a lot, so many resources were provided. So whoever wants to get vaccinated down, they really have to do a little bit of effort and maybe a lineup like in the beginning, because a lot of the places are closing down. And one of the reasons that they gave us on the platform today that they're closing down some of the places is because of underutilization. They have these people like sitting and waiting to vaccinate or to test people, and nobody's really using it for days or for weeks, or they don't have enough to be able to justify for keeping full staff of 4-3 people at a location. We don't want it to happen, but I understand the rationale behind it. So, yeah. So that's where we are with that.
Okay, thank you.
You're welcome. So, Dr. Sunday, you want to share anything going on in the hospital? Do you have more patients testing positive, or is still same from your hand?
Some people are still testing positive, but like I said before, it's mostly people that were unvaccinated. And, but the number is not really going that high, like we expect to see here and there, but it's not that bad. And one thing that the Asian community has over us is because they've been through so many things over the years, and there's been a lot of nuclear plants that they got in trouble for, and so they've learned the advantage of using the mask. The mask protected us against even most of the flu we usually get. We think majority of people didn't get the flu at all because of the mask. And before, I know when you go to the hospital and the doctors start coming in with their mask on, we look at them funny, like, what is wrong with me? So now you see everybody in masks. So it's not a bad thing to do. And we have all learned to wash our hands. It's not only just for the hospital workers. We wash our hands, we use sanitizers and stuff. So with all those things that we have put in place, it has helped to reduce this greatly. And the other thing is that anybody that is unvaccinated should go and get their vaccine. And anybody who is good to get a booster, they should go and get it. I'm usually first on the line when it's time to get those things because I see the effect of it firsthand. And you don't even want that thing in your system. You don't want that virus in your system, especially when you're old. So just to encourage everybody that is hearing this, that it's a very good thing to do, and you can encourage everybody, every member of the community, your family, that is still fighting with the vaccine and stuff, that it makes sense to get it. That's what I have to say.
Okay, thank you so much for that. Any other question, comment, concerns? Okay, I see someone coming in. Okay, so if we don't have any other question, welcome, Ms. Balogun. Thank you so much for joining us.
You're welcome.
Thank you. So we just finished giving an overview of what is going on, and the main thing that we said that take home is to just remember, God forbid, if you do get the virus, there's a medication out there that you can get from your primary care physician, or you can get from CVS, or you can also call the 212 COVID-19 hotline, and there'll be a physician on the other side to sort of counsel you and let you know if you fall within the category that can get it delivered to the home. So let's be mindful of that. Let's continue to get tested. If you feel like you're well, or you've been around people that you don't normally gather with, if you need a testing kit, Relone Foundation will be glad to provide you with a testing kit, that you need. Remember to wear your face covering if you're going around people that you're not familiar with. Is that Sister Margaret? Oh my goodness, so nice to see you. I was like, that looks like you. Wow, nice to see your face. God bless you. Yeah. So thank you for joining us. So if you don't feel pressure that you have to take off your mask if you're still not comfortable, because we do know that the virus is still spreading. It's not like crazy spreading, but that facts still remain the same. So you want to still be careful and don't get pandemic weariness and start following the basic protocol that we've been doing. So I think that's about it. Do you guys have any questions? Those that just joined us, if you have any question, if there's no question, I'll just do the announcement and I'm gonna give you guys back the rest of your night. Miss Rosie, go ahead.
Yeah, I'm sorry. I just want a good comeback, because I wear my mask, and sometimes when I'm walking in the street, I put it on. If I see people, I put it back on. So, I have this neighbor that keeps on top of me. He says, "Are you right across the street?" I mean, every time he says, "Hey, it's over. It's over. There's no, it's over. Take off your mask." And like, I just want a good comeback. I want to say to him, well, it's not, what can I say that's really, and he says to me in the hospital that there's not many people, because his wife, she's a nurse. So I want to just tell him something that's so factual that he can't,
Is this okay, just tell the person that this is an individualized decision. I have to make a decision for me, for my health, for my family. You may feel it's over and you feel comfortable to take the mask off. Good for you. But as for me and my house, we're not there yet. But maybe we'll learn from you one day and get there. But as of today, based on the information I know, I'm still going to wear my mask until I'm comfortable to take them off. That's it.
Can I help you
owe him an explanation. You don't owe him an explanation. Go ahead.
Can I help you with a nice comeback?
Go ahead.
Well, a nice comeback is going to be this. Before the pandemic, if you go to the hospitals, everybody's walking around without their mask. They only put on the mask when they're going to see a patient that is probably on contact isolation or some kind of isolation. They don't even put on their mask to go and see the patient unless the patient is on contact isolation.
Sure.
So the question you're asking, if the doctors in the hospital, if every secretary in the hospital is still mandated to put on a mask, there's something the medical team understand that is still going on. So unless he has the MD behind his name, it's not over yet.
That's a good one.
I wrote it down. Thank you.
You wrote it down. Even also in the schools, for the student or the teacher, when they want to come into the nursing office, they have to put their mask on. The nurses are still mandated to keep their mask on in the medical room, but it's optional for the staff when they're outside, for the student when they're in the classroom. But once you want to come into the medical room, you have to put your mask on, so that speaks to the point that Sunday is trying to make, that there's still something out there, which we all saw from the data that was shared, that there's still something out there, that will run for us. Even when you go to, like I went to a Broadway show, you have to wear your mask throughout. They don't even they don't sell like food or anything in there. You can't bring any food there or drink. You have to keep your mask on throughout the show, So yeah, I think that's the only way they've been able to keep those doors open, and prevent a mass spread event. Because if people are eating and they're still closely sitting together, that might be a challenge. Yeah. So you got like 2 or 3 comebacks, so you can pick Whichever one.
I wrote it down.
Okay, cool.
I wrote
Excellent.
everything. I appreciate it because it's not,
Absolutely.
yeah, that's it. But thank you.
You are welcome. You are welcome. Any other questions, comments? Okay, so look like we're gonna finish early today. I'm gonna just share my screen. And no question, right? Sister Moto, you're good? Lumna, you good? Sister Ingrid? Miss Yvette? Okay, everybody's good.
Yes, I'm here. Yes, it was
Okay.
good. I like the answer you give.
You like my, I can't remember what I said, but thank you for liking it.
Yeah, but the Sunday answer was good.
But the Sunday one was official.
It's too
You know,
official for
but
you.
your own was every day. That's how you tell them. I like yours.
So
Yeah.
she has two weapons. She can decide to use whichever one she pleases.
Whatever one she wants, but the one
Yes, Sister Rosie.
that you gave, that's the one that I tell anybody ask me anything on math.
Yeah.
That's what I say to them. It's a personal. You go wear it if you want. I wear it because
Yeah.
I want.
We know it's not over.
Yeah, yeah,
Exactly.
yeah. So we know
Yeah.
our vice president just got infected, so I don't
True.
know what they're talking about. So
Yeah,
we want it to be over definitely, but you know, we're getting there, but we're not there yet. And
No.
if
Not
Dr.
there yet.
Dr. Fauci was saying that, of course, it's gonna be. He doesn't think we're gonna get rid of the virus. That it's gonna probably
Yeah.
become endemic, just like we've been seeing on this platform. You know, so we still have to be prepared, have that mindset that
Yes.
you know that's what it's gonna be.
I think so. Yeah. So
Yes.
you just get accustomed to the mask. That's
Yeah.
it.
Gotta protect yourself and your family.
Yep.
Amen. Yeah.
Amen. Okay, I'm gonna show you a flyer, and then I will tell you what it's all about, and then you guys can, if you don't have any more questions, I'm gonna let you guys have the rest of your night. That's so good. We get to like have a night back. Woo, woo, woo. Okay, I know you guys know we've been doing Mia Bule, which means in the village. So this coming Saturday, May 7th at 1 p.m., we're gonna be having our first in-person meeting. This is an event you have to register for. We have space for only 15 families. You know, that means if parents want to come, they can come with their kids. Parents that have kids between the age of birth to 7 years old, you know, and we're gonna, the ACT Studio, we're partnering with ACT Studio, sponsored by 450 Robin Wood. They're going to be present Story Come to Life. I cannot say the word of the book they have to read. Maybe Sister Moro can help me. It's a chrysanthemum. Did I say it right?
Chrysanthemum, yes.
Yeah, I got it. Oh, wow, look at that. That was good. Yeah, that is the book. So we'll be reading and dramatizing it, and you know the way city goes, putting some music and theatrical and showing the kids and the parents how we can use drama and music to enhance the cognitive skills of kids, even from birth, even while they're still in the womb. You know, the power of music, the power of reading stories to them. And yes, it's really amazing. So if you know someone that can benefit from this, you can have them text me directly so I can hold the spot for them. I think we have about maybe 4 spots or so left, you know, so yeah, I will share it on this platform. And then after the monthly one, we still have the bi-weekly meeting every Tuesday. I don't know if you were on it last Tuesday. It was like so great.
Oh yes, it was great. It was great.
Good.
It was tremendous. Everybody learned. It was unbelievable.
Yes. And then the men contributed too. So
I know the men went up to on fire. I was like, oh, thank you so much, Pastor John, for sending the men to join us. That was really a great discussion. And yeah, I wish we could have recorded it, but because it was so personal discussion, it wasn't something I wanted to record, but it was really good. So if this last episode, we're gonna continue. Actually, what the ladies had planned for that day, they couldn't finish it because the conversation was so good. They didn't even finish one thought of what they had planned. So they're like, oh my God, that they're good for the next presentation. So the next one will be, I think, May, not this Tuesday, the Tuesday after
Next
tomorrow.
Tuesday. Mhm.
What date is that?
May 10th, I think it is.
10th,
10th.
yes, May 10th is the next near Bule. So if you guys need any clarity, just shoot me a text and I'll share the information with you. So that's about it for tonight. And
All right.
I'm gonna wish you guys have a good night.
Thank
Good
you.
night,
You too. Have a
everybody.
good night. You have a good night too.
God
Sweet
bless you.
dreams. Sweet
Thank
Bye,
you,
Good night,
Sherry.
everybody.
Good night,
Be
Good
blessed.
everyone.
night.
Good night. Good
Bye.
night. Bye.
Good night. Thank you.
Good night.
Hi, my
Good
sister.
night.
Good night. Auntie
How you
Fanny, how
doing?
you doing?
I'm still at work. I'm
I
busy.
know I can see you're still at work. Let me show my face quickly.
Yeah. Good night.